Alzheimer's disease is one of the saddest conditions to talk about, mainly because it is essentially without any treatments. Let's look at Alzheimer's. Let's talk about the symptoms. It begins with progressive memory decline. Related to this, the condition begins in the medial temporal lobe, where the hippocampus is. Now, the memory decline, early on, they forget recent events. But as the condition progresses, older events are forgotten. So it's sort of like I think of this is your time history. Alzheimer's is like a eraser that's just sort of going retroactive here. So first you're forgetting where are my keys, where's my car, did I shower today, when was the last time I ate. Then you're forgetting your kid's name. But this is really confusing if we stop here, because the patient will say, what do you mean my memory's faulty? I remember my high school friends. I remember my first grade teacher. I remember the first house. I remember the house I grew up in. My memory's fine. You'll say, well, unfortunately, this is exactly the pattern you expect to see in Alzheimer's. It's very frustrating, very sad. Now, while the condition begins in the medial temporal lobe, this is a degenerative disease, meaning neural death. We'll talk in a moment about maybe why these neurons are dying and consequences of their death. But let's look at this image here. So this is an Alzheimer's brain. This is a healthier age-matched control. What I'd like you to notice is the size of these sulci. They're extremely large and they've gotten very deep. This is all a sulcus. Versus the tight sulci you see in a healthy brain. Now, why are you seeing this? Because the brain is retreating. The brain is degenerating. Neurons are dying. And as the brain retreats, the negative spaces of the sulci get bigger and bigger. You're losing brain. And here you see, I think, immediately why this condition is such a massive challenge to treat. How do you come back from this? Can you get this brain to here? It's a big question mark, and I fear probably not. This is a devastating condition. Anyone who's seen Alzheimer's can tell you it is devastating. So progressive memory loss. There's also confusion. Generally getting confused easily, but also to time, place, current events. There's language deterioration. Early on, you're going to see word finding difficulties. I can't come up with the right word to say. This happens to all of us, but it happens with increasing frequency. And, it happens to me while I'm giving lecture. But when you're looking for complex, high-level descriptive words, that's more likely to occur. But if I'm trying to say, can you hand me the iron, and I can't remember the word iron, then that's a problem. And if it's happening over and over and over and over. Later on, There's reduced speech output, reduced understanding the language, and then later there's total loss of language. There's also behavioral changes, lethargic. It can look like depression. Depression like. So they sleep a lot, they don't want to do much, they don't seem to experience as much joy in their life. Now, an interesting variable in Alzheimer's is insight or self awareness. Do they know how sick they are? Well, early on, the answer would be yes. And this leads to denial and anger. And of course, absolute deadening terror. In the middle stages, they lose insight. They lose an awareness of just how sick they are. And then later on, everything is gone, so you can't hope for insight. Go ahead and watch this video. The link is in the description. And you will meet two patients, Harvey and I can't remember the other guy's name, unfortunately, but Harvey and Lawrence. They're two patients in the mid stages, and I want you to pay attention to their insight. Go watch that and come back. Well, what you saw were two men and two families dealing with Alzheimer's. Both of them, their self-evaluation is that they're doing all right, they're fine, they're okay. Their memory's not great, but they're okay. But then one of them goes on to demonstrate that he can't remember one of his sons. Then the other one tells you that his parents are both still alive, which is a mathematical, chronological impossibility. When you look at the brains of Alzheimer's patients, you see two telltale signs. And in fact, today, these are the diagnostic pathological markers required to diagnose Alzheimer's. So technically, in a living patient, you're not supposed to diagnose Alzheimer's. It's presumed Alzheimer's. You're supposed to wait until you can look at their brain and find beta amyloid plaques and tau-filled neurofibrillary tangles. Again, we're talking faulty proteins. Faulty proteins build up and they kill neurons. And you know what? You end up with beta amyloid deposits. You end up with neurofibrillary tangles. You end up with a brain that is dying. You end up with neurons that are dying, and because of their death, leading to more protein buildup. Now, treatments. Treatments for Alzheimer's are pretty bare bone. There's one drug, but it does almost nothing. I believe it's called Aricept. Keep meaning to check on it. It might be Aris. Doesn't matter. There's one drug, but it doesn't really do anything. It delays the inevitable decline by a couple of months. So the patient looks like this. So this is the best we have to offer our grandparents, our loved ones, right? This is unacceptable. Alzheimer's research is one of the most depressing fields to follow because there's time after time drugs look promising in animals and then they fail in humans. What have been tried? Well, drugs have been tried to try to break up these deposits and they fail. Even when the deposits are able to be cleaned up, the patient doesn't get better. Why? I point you to this. How are you going to get from there to here just by cleaning up deposits? It's illogical to me. I don't even understand why the drug companies wasted so much time on it. But they've basically given up. Many drug companies have publicly announced that they're not going to do any more Alzheimer's drug research, which is so depressing. You might wonder, what if you try to prevent the buildup of these deposits? Well, these deposits build up over the lifespan. What are you going to do? Give perfectly healthy people meds for 60 years because they may develop Alzheimer's and this drug may reduce these deposits, which may reduce the chances of Alzheimer's? I wouldn't take that drug because they're not going to be mild drugs with no side effects. Well, these plaques and tangles have been the basis for understanding Alzheimer's, but recently people are starting to think differently. Partly because they're seeing that it seems like it's too late at this point. Well, there's another factor here, is neuroinflammation. Inflammation. Inflammation. Inflammation is what happens when tissue is irritated and your body tries to go to work dealing with that irritated tissue. Now, unfortunately, a lot of times inflammation is absolutely toxic. We know the brains of Alzheimer's patients are inflamed. That's a pretty proven fact at this point. In the last 10 years, they've been demonstrating that. So now the question is, what do you do about it? Do you think if I give an Alzheimer's patient anti-inflammatory drugs that they'll get better? How is reduced inflammation going to return millions of lost neurons? Well, maybe you might say, what if we try to reduce inflammation across the lifespan? Well, yeah, I hear you, but we're back to the same thing. What are you going to take Advil every day, 4 times a day for 60 years? Your poor stomach will bleed and you'll likely die because of that if you're taking Advil for that long. No one would do that. So I don't know where we are with Alzheimer's. It's very sad. It needs a lot of attention. It needs some bright minds. We need to figure out what's going on. Here's some images. Scientists, including at UCLA, have been working very hard in trying to image beta amyloid and tau in living people, so that you can study them better, you can follow progression, you can diagnose before someone's dead, all these things. Well, here's a scan. These are PET scans. These are hugely smooth images. This is scientific cheating, if you ask me. But anyway, the message is still clear. There's going to be beta amyloid protein in healthy brains, but there's a lot more of it in Alzheimer's brains. Tau protein, again, you're going to see some of it in healthy brains, but you're going to see a lot more of it in Alzheimer's brains. These are not FDA approved yet. I have no idea why. Before I move on from Alzheimer's, a little word on terminology, okay? Alzheimer's is the most common type of dementia. Dementia is a broad umbrella term that includes Alzheimer's disease. It includes frontotemporal dementia. It includes vascular dementia. This is a kind of dementia associated with tiny but many strokes that happen throughout the brain, associated with high blood pressure and diabetes again. And there are other oddball kinds of dementias. Alzheimer's is the most common type, because a lot of people think Alzheimer's and dementia are different things, but Alzheimer's is the most common type of dementia. Just want to clear that up.